Hey everyone, welcome to today's episode of Beyond the Checkbox. We've brought in an expert in ADHD, in particular adult ADHD. So Dr. Sara Binder is an expert in this field and talks about the treatment of ADHD, talks about what causes it, talks about how we can use and apply these practical tips because everyone is on that ADHD spectrum. I was very grateful for Dr. Binder to come join us on the show. And it might have even been a little bit validating for me because my brain moves at a pace that is unsustainable and not always productive. So you might even say I have a touch of what she was talking about on the podcast. So thanks again for joining us. We're really out there to try and make this as applicable and practical and make mental health as simple as possible so you can get some takeaways from it. Welcome to the Beyond the Checkbox and enjoy the show today. How often is it that you're seeing someone that is not previously diagnosed? Because you're the person, right, to see adult ADHD, like you're the expert.
I think it's more common than not. If we look at sort of numbers of people who are in the mental health system, the prevalence is very high, like between 30 to 40% in outpatient adult mental health clinics. When we look at sort of general population prevalence, our studies are really old, but they sort of range more in the 5 to 10%. But because as people go untreated through their life, they accumulate diagnoses. So by adulthood, comorbidity is the norm, right? So 85% of people who didn't get diagnosed as a kid or as a teen will develop common comorbid conditions like depression, anxiety, self-medicate with substances, get diagnosed with personality disorders. So they're sort of in our system. And because our clinic takes referrals from Emerge, when people go to Emerge, that tends not to be what people are thinking about or looking for or assessing for. Even if someone maybe says they have ADHD, I often find that's not highlighted in the referral. So the problem, though, is that if you don't actually pick that piece up and it goes undiagnosed and untreated, it's almost like we're treating the sequelae or we're treating the symptoms in a bit of a sort of a Band-Aid solution way.
I think a lot of the people who listen to this show would benefit from just knowing what ADHD is because that is the top bandied about diagnoses in the history of mental health. So like, what is it? And let's then get into like, everyone says now I have ADHD. So let's get into that piece too. So let's start from the studs. What is ADHD?
So, I mean, it stands for attention deficit hyperactivity disorder, but it's a bit of a misnomer because it's not broad spectrum inattention to everything all the time. And there are subsets of ADHD. People used to sort of talk about ADHD and ADD if they didn't have the hyperactivity component. Everybody will have the diagnosis of ADHD, but there's the subset. So some will be more an inattentive subtype where they struggle more with symptoms related to focus, concentration. They struggle with their memory. They struggle with organization, time management, losing things, misplacing things, procrastination. Those would be a lot of the sort of inattentive symptoms. And for many people, that's the primary set of symptoms they struggle with. When we look at the hyperactivity impulsive subset, those tend to be the ones that get picked up earlier because it's more overt. So that's historically what people think about as being like the prototypical little boy who's bouncing off the walls, can't sit still, talking all the time, pushing, shoving, interrupting, blurting. And so when that is presenting itself early on, it's disruptive in the classroom, it's disruptive on play dates, on teams, wherever. And so it's diagnosed earlier. So when we look at what are those symptom criteria, so the hyperactivity is, can't sit still for long periods of time, tend to like fidget, move around a lot, need to kind of get out this internalized energy by the movement. And sometimes it's overt movements like the running and jumping and climbing, but other times it's more subtle. Like it could be pen clicking, twiddling thumbs, picking at skin, playing with hair, doodling, leg bouncing, toe tapping. So that we see that everywhere. I mean, once you know it, you go to any restaurant and you're like, there's someone with ADHD. There's someone with, like, the constant leg bouncing that's happening under the table, right? And people will sort of say, if they're not able to move, that energy gets internalized and it feels like restlessness and sometimes gets misinterpreted as anxiety. But when you ask those people, well, what are you mentally worried about? Like, what are the anxiety symptoms? It's physical. And so it's sort of that physical internalized restlessness kind of gets misinterpreted as anxiety. And then the impulsivity is basically the inability to stop and think before you say or do. So that can be excessive talking, blurting, interrupting, taking risks, speeding, going down hills without proper equipment, kind of the adrenaline junkie stuff. But it also can lead to a lot of addictive behaviors. So our typical ones of sort of substances, drugs, alcohol, lots of caffeine, but also behavioral addictions. So sex, porn, gambling, gaming, internet, binge eating, all of those are much more common in ADHD. And then the last subset that we see a ton of is emotional dysregulation. So the inability to regulate emotions, going from 0 to 100 in a flash, and then either recovering quickly or getting stuck in it.
What's going on in the brain with someone like this? Like, do we have a good understanding of sort of the mechanics of it?
Yeah, I think we have an excellent understanding because, this is one of the few conditions that was recognized in kids primarily. And so diagnosed and treated in kids for decades and decades, and all the meds studied for kids and then later on used in adults. So what we know is that it really comes down to two main neurotransmitters, which are dopamine and norepinephrine. So dopamine being pleasure reward and norepinephrine more like adrenaline. And so people with ADHD have insufficient levels of dopamine and norepinephrine and inconsistent levels. And those two are so important for our executive functioning. So our higher level brain functioning, our ability to think, to plan, to prioritize, but also to regulate emotions and control impulses. So prefrontal cortex, like higher brain level, but also kind of our reward center. And so where people get so confused about ADHD is that if someone with ADHD is doing something that drives dopamine, super interesting to them, pleasurable, rewarding, stimulating, they will do the opposite of inattentive behavior. They'll hyperfocus. So they can spend hours and hours at any sort of given task that's driving dopamine. And so you hear lots of people say, oh no, that kid couldn't have ADHD. They can, play Lego for 5 hours straight, or they can video game all night, or read books till, they can't stay awake any longer. So that's sort of one area where we see people with ADHD kind of have this inconsistency. And then the norepi is more like when you've left things long enough that didn't naturally drive your brain. So you procrastinate, and then you have a deadline and you have to get something done. You get that surge of norepinephrine. And so lots of people with ADHD are deadline people. They can pull off amazing amounts of work with, the last couple of days before the deadline, or if they're something super important, that will also drive norepi. So you see this sort of pattern of being consistently inconsistent, sometimes performing amazingly well, super productive, super efficient, but it's really in fits and spurts. And then other times, like barely able to function with the most basic tasks.
Is the most beneficial thing to change that person's brain through medications and maybe therapy and tools, or is it more important to change the environment?
I would say both are important, but in major studies where they've compared the meds and all the sort of standard treatments, it's for sure the medications. Because if you don't actually normalize or stabilize the levels of dopamine and norepinephrine, people find it extremely hard to consistently engage in the behaviors or the learned skills and strategies. So adults, over time, people learn how to cope to greater or lesser degrees. But some people are highly intelligent and high functioning with ADHD, and other people at the opposite end of the spectrum are barely able to function and are in jail or on the street or using substances. So it's going to be unique to the individual. But if you don't get at that brain chemistry and stabilize the dopamine and norepinephrine with the medications that are called stimulants, because they stimulate dopamine and norepinephrine, people find it very, very difficult to consistently practice the behaviors.
And you said there's some people who are high functioning with that. Is it a matter of intelligence? Is that I imagine impulse control is also important. Like if you're if you have ADHD and you can't control your impulses and you're not as cognitively intelligent, that's a recipe for not functioning super well.
Yeah, that's a recipe for disaster. I would say that no, it does not come down to intelligence. I mean, ADHD doesn't sort of spare anyone. It's actually highly heritable. It's almost as inheritable as height. So it runs in families. So you might have families of highly intelligent, highly productive people where ADHD is in the mix. And some people in that family are super successful in part because of their ADHD. Because lots of people with ADHD will think outside the box. They're ideas people, and then they get into an entrepreneurial area or something of interest. And as long as they can find the people to do the scut work or do the elements of the job that they're not very good at or consistent at, they can, fly. Like we see a lot of people out there who are very successful. Lots of elite athletes have ADHD. And then, yes, at the other end of the spectrum, you see people who don't have that structure, they don't have the scaffolding, they don't have the parental or academic supports to help them learn the tools to manage, or they have the low intellect and don't have insight.
Is it getting worse? Like, are there more people diagnosed with it? Like, it's more common, like people are talking about it more commonly. But a question I always get, and I don't know how to answer it, is it getting more recognized? Is it getting more diagnosed? Are we making it worse with phones? Like there's this whole cultural thing around it now, and I don't know quite how to approach it.
Well, I think it's all of that. So yes, it's more recognized. So I think the population's more aware of it. And so because people can go online or be on social media and learn about it, then they're more apt to sort of recognize it in themselves and then take it to their primary care physician or whomever and ask about it. I think there's more awareness, therefore, in healthcare professionals. I feel like psychiatrists are still way behind in terms of
diagnosing it or like self-diagnosing it.
Well,
are you talking about me right now, Sarah? Just like put that out there. Because I feel like a lot of this conversation has been directed at how my brain works.
Well, I do have a lot of files that are our colleagues, but no, I mean there's a lot of doctors who have ADHD, right? And I think there's certain emerge docs, right? There's certain professions, a lot of surgeons. Like there are certain areas of medicine that attract people with ADHD where you can be, spontaneous and move from task to task, and but it's whatever drives dopamine. Really, that's kind of what it comes down to. So it's more recognized in the general population. I would say family docs are getting way better about diagnosing, treating. Psychiatrists hit and miss, unfortunately. I mean, I think we're not trained as well in our programs, and people still sometimes are deniers, which is ridiculous.
What do you make of that? Can I dig into that? That's super interesting because there's this like socio-cultural thing, like we're over-diagnosing and everyone has ADHD now. And are psychiatrists playing into that? Is that why they're deniers?
Yes, I think so. I mean, it's when I first started working in this area, 15 years ago or whatever, I was very tentative and, I didn't want to rock the boat or offend or appear that I was sort of over-diagnosing. At this point, I have no problem saying if you're not assessing every patient you see, in the same way you would assess them for their mood disorders, their anxiety disorders, their psychotic disorders, their substance use disorders, you are doing your patients a disservice because of the high prevalence, as I mentioned at the beginning, in mental health in the population. I mean, it's higher prevalence than psychosis and bipolar combined.
Yeah, that makes sense. Yeah.
And because by adulthood, 85% of these people have a mood disorder, have an anxiety disorder, have a substance use disorder. If you're not actually assessing the patients who come to you, you're missing it in a ton. And that's what I see. I mean, I see all these patients where it's missed over and over again. They've been tried on 10 different antidepressants. They've been tried on mood stabilizers. They've been in addictions programs. Why would you not treat somebody who's in front of you, who meets the criteria? That's how we diagnose mental health conditions, and are impaired because of it, when we have really good drugs that are twice as effective as antidepressants. Like, to me, it's a no-brainer. Yeah. And yeah, I think our profession needs to get with the times.
What do you think it is? Why do you think they're not? I have a take. I think we're way more comfortable giving out antidepressants than we are stimulants. That's like for starters. But also there's this like, I feel like if I did it as in-depth of screen for ADHD as I did as a psychiatrist for the other stuff I do, I would be handing out ADHD meds like everywhere. And maybe I don't have the training or something there, but like, what do you think it is?
Well, I think it's lack of knowledge, lack of awareness, lack of training. But I also think that there's some fear, partly because of that lack of knowledge and understanding. And historically, the short-acting stimulants we used to treat ADHD had a risk of abuse and diversion. So,
Okay.
If you have anything that acts in that quick capacity, there's a higher likability effect. So patients are going to experience it and like it and want more of it. But we don't use those drugs anymore. They're not first line. The drugs we use now are long acting. Their abuse potential is extremely low. They're very safe. They're very effective. And as I said, they're twice as effective as antidepressants. And so, I mean, it took a long time for people to recognize depression and start treating it. But now I feel like antidepressants are handed out like candy, right? So are newer antipsychotics, because they're also used to boost the effect of antidepressants. Benzos, which are highly addictive, sleep medication. Like, there's so many medications that people would do like a very cursory screen and be like, oh yeah, you're depressed, here's your drug. Whereas for ADHD, there's this sort of, people are drug seeking.
Yeah.
Well,
Yep.
really, I don't know. I don't think they're drug seeking if they have a condition that's impairing their functioning and you've given them 10 other drugs that aren't working. Maybe you're missing the mark. And that's where I think people, if people aren't responding to our typical treatments for the depression, the anxiety, they're not, doing well with their addiction treatment. What are we missing something?
What are the most common things people ask you when you propose a medication? What are the most common like pushbacks or concerns or objections when you're like, I think you have ADHD. I think you should have a treatment of some sort?
Well, they want to know, will they be on it forever? Is it addictive? Will it permanently change their brain? Those are sort of common questions. So in answer to that, I don't know. I mean, whether you'll be on it forever, I would say it's a bit like glasses for the brain. So you wouldn't pick and choose when to wear your glasses. You'd probably wear them all day, every day, because you're more functional. You can see more clearly. You can probably drive more safely. You can, and unless you got corrective eye surgery, you probably keep wearing those glasses long term. So I would say most people, once they're treated, if the meds are effective and well tolerated without a lot of side effects, choose to continue to take them, because it's sort of allows them to function at the level that they actually are capable of functioning in a more consistent, stable fashion. Can they still perform without treatment? Probably, but what is the effort? And what are the consequences of all that effort? And then what's being missed? So maybe you're doing really well at your job, but you're barely functioning at home because the home life is not interesting and stimulating for you, and you become the third child, right? So will people stay on them long term? Yes, if they feel they're effective and they're pretty safe in the long term. Like, there are very few reasons to not take them, but of course we need to make sure everybody is unique and make sure that there's no reasons to stop. And then the dependency thing, no, I mean, they're not addictive. As I said, they sort of act in that sort of long acting capacity, take it in the morning. And we actually aim to treat people till they go to bed. And so if people are taking even a long-acting med and it's wearing off, say, around dinner time or late afternoon, they're going to get a rebound in ADHD symptoms and then have more struggles in the evening. So that's something a lot of clinicians don't recognize, that even the long-acting stimulants sometimes need to be topped up and extended to bedtime. People wonder about impact on sleep, and I think that clinicians worry about that too. But in fact, all the evidence shows that, one, the majority of people with untreated ADHD have had lifelong struggles with sleep, because the ADHD brain is seeking constant stimulation. So it will go towards things that stimulate dopamine, pleasure, reward, or things that stimulate norepi. So worries, obsessional thoughts, ruminations. And so it's very hard for people to shut their brain off when they go to bed. That's when the brain gets going.
Could you clarify something again? So the ADHD brain either seeks reward and stimulation, or it seeks just plain old activity, whether it's worry or ruminations or obsessions.
Yeah. So a lot of people with anxiety have underlying ADHD. And when we treat the ADHD, their brains calm down because the brain's not seeking that stimulation. So they can let go of the worries, they can let go of the obsessional thoughts, they can let go of the ruminations.
Super interesting. Yeah, and you could see how our modern day environments have made that somebody who has ADHD would make it worse, right? Because you have these little devices that are little pleasure seeking,
Yeah.
or just activity seeking devices. Like you flip through the news and it's all like death and destruction, or you flip through like a gambling app and it's just either it's just activity, which is what you're saying your brain is seeking when you have ADHD, constant stimulation and activity.
So yes, when you ask the question, is it pills and skills? Is it environment? It's both, because I think our environment is, it sort of feeds ADHD.
Yeah.
It's very hard for someone with ADHD to resist all of those stimulants in the form of social media, news, doom scrolling, gambling. I mean, you can access it at your fingertips. So many people will get caught up in a lot of those as a means to stimulate their brain, basically.
Can you give us a couple skills? I might be talking from personal experience. What are some skills that we could use and deploy, at home, in our work, so that we can practice? I think that everyone has a little teeny bit of this, and I imagine we're all on a spectrum of it. Is that fair to say?
Yeah, I think so.
And so we could all benefit from some of these skills that you deploy in that entire spectrum. So what can we do? How can we reduce that dopamine seeking and norepinephrine driving part of our brain that makes us dysfunctional sometimes?
So, I mean, I think going back to the basics is the simplest place to start. And I always talk to patients about pills and skills. I'm not going to give you a pill that's just going to cure all, right? And if you think about the most basic skills as being foundational, I like to sort of talk about the 4 pillars. And the analogy is like a tabletop that has 4 legs. And we've all been to a restaurant where one of the legs is like uneven and you have a wobbly table, which is not only highly annoying, but also you have this very unstable surface. So if you don't solidify the pillars of that table, it doesn't matter what I give you, what medication, it's not going to be very effective on that wobbly foundation. So the foundational pieces or pillars are sleep, diet, exercise, structure, and routine.
Sleep, diet, exercise, routine.
So sleep, you want to aim for 8 hours consistent bedtime wake up time, because if you're sleep deprived, which many people with ADHD are, because the brain kicks in at night and they get going down rabbit holes, and even though their intention was to go to bed by midnight, oh, it's 2 a.m. and I've spent the last 2 hours searching up a rare form of whatever. I don't know, right? I mean, or video gaming or reading a book or binging on Netflix or whatever it is. So having some strategies to shut things down so that you actually go to bed at your intended time, give yourself some time to wind down, bedtime routine, and then wake up consistently. And that also helps us with our circadian rhythms, the internal hormones and so on, that will help us feel sleepy at bedtime, like high melatonin at night, low in the morning. But if you're sleep deprived chronically, sleep deprivation mimics ADHD, like almost 100%. So treating ADHD in the context of sleep deprivation is not going to be very effective. So sleep is very important. And sometimes people need medications short term to get them on track. And we have some nice new ones that, are not addictive and not super sedating. So I think those are good things for people to discuss with their doctors. Diet. So I don't sort of mean go on a diet. I mean, eat a relatively healthy, balanced diet, eat kind of couple times a day, drink a lot of water, avoid caffeine. So if we're treating ADHD, many people self-medicate with caffeine. I mean, coffee is like ubiquitous in our society, right? How much do we all spend on Starbucks or whatever else? I don't know. There's some $100 special coffee. You can go try at Phil and Sebastian in Calgary. Anyways. So if you try the ADHD meds with caffeine, people don't tolerate them very well. They get a lot of side effects. They're overstimulated. They feel jittery, overcaffeinated, heart racing. So it's important to lots of water, eat relatively healthy, take your meds with food in the morning that has some protein, and then remind yourself to eat during the day, because appetite suppression can happen. Exercise. So if you sort of think about how we're raised, often when we're young, we're pretty active, we have lots of outlets, and schools aren't great for that, but lots of kids get involved in extracurricular activities, sports, and so on. And then it's sort of in the teen years and into adulthood that people kind of leave organized sport and become more sedentary. And I see that pattern so often for individuals who are diagnosed in kind of early adulthood, that they were very, very active. And then when they left their sport or their activity, that's when a lot of the symptoms started to become more pronounced. So getting back into regular physical activity, I mean, we know all the benefits physically, but mentally doing that, not just for someone with ADHD, but for depression, anxiety, to help with sleep, to help with energy. I mean, I think it's golden and it's necessary. Everybody should be exercising. And then structure, routine. So people with ADHD thrive when they have clear structure and routine. And they don't do very well when they're not working, when they're on vacation, when the semester ends. That's when things kind of go to pot, right? Because it's like, oh, it's a free-for-all. And that's when the brain starts seeking those stimulants. And people tend to feel worse and not better unless they plan for unscheduled, unstructured time.
Yeah, that's so helpful. And the thing that really hit me was the vacation thing. Like, and maybe you could talk to my wife about this. I don't do very well on vacations. Like, I can't chill out or just like just like not do something or sit on a beach all day. Drives me absolutely insane.
Well, and I kind of had to learn that over time, that I'd see all these people who would like go on vacation and then not have done very well, like felt worse, not better, and then have such a hard time readjusting back to kind of the routine of regular life. So now I kind of talk to people about that so they can pre-plan a bit and make sure they kind of keep some consistency even when they're, supposed to be relaxing.
Do you ever talk to patients and people about guilt around this? Because I think a lot of people, especially, I don't know, like in the workplace, you feel guilty that you can't go home and just relax and do nothing with your toddler. Or you feel guilty that you can't just relax on a holiday like everyone else sits on a beach. Does that come up?
Oh yeah. I mean, there are a lot of emotions attached to having lived with undiagnosed ADHD that, people kind of have a sense of what they're capable of, and others sort of see that, but not consistently. And so then there's a lot of guilt and shame and a real impact on sense of self. So I use this functional impairment rating scale for people when I'm assessing them. And the self concept area is where you just see it over and over again, that people's sense of self is so poor, even though on paper they're maybe functioning very well, like professionally, personally, etc. Because I think it's that idea, you know what you're capable of, you can't do it consistently, you know what effort it takes to perform. So there's a bit of that imposter complex, like, oh, well, yeah, if only you knew what I have to do to get this shit done or to actually perform well.
Yeah.
It's a lot. And so that's one piece I like to look at and work with people on through treatment, because that doesn't change overnight. I mean, that's something that people accumulate over their life. And so it takes time with treatment to sort of start accumulating more kind of positive sense of self or a more balanced sense of self, and to feel more confident that, yeah, you can be more sort of consistent and you can, perform in those areas that have historically been really hard.
Awesome. I think this has been really validating for people who are listening and might be struggling, thinking about adult ADHD, because I think it's seen as something that kids have, like you said, little boys have and adults can't have, and undiagnosed is the main thing. I also think it's really important for people to understand the physiology, the norepinephrine dopamine thing, and the skills were really important.
And I just want to add one
Yeah,
thing
yeah.
in, because the one piece that I think we actually see, so the little boy piece, I mean, the numbers are kind of crazy. We see boys to girls diagnosed at like a 10-to-1 ratio,
10
and
boys to
then
one girl.
to one girl,
Yeah.
because of that whole, they get picked up because they're causing disturbances and problems and whatnot. But by adulthood, it's like 1-to-1. So then you kind of question what's happened to all those girls that went undiagnosed and untreated until adulthood. And a lot of them, if they're more anxious, that tends to, again, kind of like mitigate a lot of the overt hyper impulsive stuff, because they don't want to stand out. They don't want attention focused on them. They're people pleasers. But once hormones start to kick in adolescence, we see more of the emotional dysregulation. We see a bit more of the impulsivity. And so they start to kind of have more struggles and internalize more. So we see a lot of the depression, anxiety, eating disorders, a lot of that sort of present in adolescence. But one of the really important things for females, which is, a little bit different than the males with ADHD, is the cyclical impact on ADHD. So we've talked about dopamine and how important that is. Estrogen, we know, cycles through the menstrual cycle, and it peaks in the middle at ovulation and it's at its lowest during PMS. Dopamine actually tracks super closely with estrogen. So women with ADHD will often do really well part of their cycle and then have really big challenges during PMS. So not just sort of the mood and physical, but cognitive. So have a hard time managing their ADHD symptoms. And then lots of struggles during sort of pregnancy and postpartum. So postpartum is a high risk time for females with ADHD, because all the coping mechanisms are out the window and they don't have the structure. They're not getting sleep. They're not eating. They're not exercising. So even if they manage well before, not managing during postpartum. And then perimenopause, menopause. So all there's sort of times for females where ADHD will become kind of more prominent and more functionally impairing. So it's really important to for us as clinicians to be aware of that, but also for individuals to kind of know that if they've had some of those struggles, it would be good to talk to their doctor and see if ADHD is potentially in the mix. Because so many women will get treated for, premenstrual dysphoric disorder or postpartum depression or whatever else, but sometimes it's a lot more simple.
And one thing I've seen too is a psychiatrist is like our medications work-ish, and
Yes.
ADHD medications work really well if that person has ADHD.
Exactly.
Like they're probably, I don't know, the most effective mental health medications when you're treating a thing that you know what thing it is.
They're the highest effect size of all meds in medicine.
Like better than like you
They're
have an infection and you take penicillin.
Yeah, like we don't, I mean, yeah. So you're right. I mean, that's why if you can get people off all those other meds and treat their ADHD, it's so much more simple and it actually works.
I love it. Dr. Sara Binder, awesome. Thank you. This is a great discussion, and I think a lot of people are going to benefit from it. So thanks for the work that you do. I imagine it's rewarding because you can like see people diagnosed, treated, it works. And I appreciate you sharing that on the podcast today.
Yeah, well, thanks for your interest. It's something I'm obviously a little bit passionate about. So.